Hey everybody, it's Deborah Carter here from Preparation Tech. Today I'm speaking with the lovely Coty Snider in Canada. Coty is doing really important work at the moment. She is a public health nurse in the division of her community that deals with COVID-19, how to manage the cases and the infections and to track the spread and everything else. But I'm just going to hand it over to Coty. Welcome. Coty, tell us who you are, what you do, and how it relates to tech.
Hi, Deborah. Thanks so much for having me. My name is Coty Snider. I'm a registered nurse. I work as a public health nurse in my community, and right now we're working directly with the COVID-19 pandemic. Public health nursing is a little bit different than traditional nursing. Often when people hear I'm a nurse, they ask which hospital I work in. And although I have amazing colleagues that work in the hospitals, public health nursing is sort of one step removed. We look at health from a community level. We work a lot with prevention, with access to resources for our community members, health promotion. We deal with advocacy, and evaluation of programs and client outcomes. So the difference between my role and a frontline is I'm not caring for one person, I'm caring for the community as a whole.
Wow. And I can imagine, because you have to kind of track the spread and the cases, that you're using a lot of technology. Can you tell me a bit about the technology that you're using?
Yes. So in my role, we use a lot of software and databases. So we have machines such as tablets and cell phones and laptops, of course, that we're working with. And then we have a number of electronic medical records that we can access regionally, provincially. We have statistical databases that we enter and pull information from. And we use other tools such as communication apps so we can securely share information with patients. We can connect with people in virtual environments, and we do a lot of health teaching and referrals through that manner.
Wow, can you give me an example of how you use the virtual environment, like a concrete example?
Yes. So, for example, if we are in contact with a patient who has a result that they want to receive, we can use a virtual environment to securely share their test results, and we can talk to them face-to-face about their condition, provide health teaching, and what the next steps are for them and their family.
Wow. What are some of the craziest events, the experiences that you've had, like related to this? You don't have to mention any specific patient, but just like weird, crazy, uncomfortable, funny, whatever.
Yeah. The whole thing has been, since February and March, was when Ontario went into a lockdown. It's all been wild. So all hands on deck, people that I have never met within my workplace and my community, we're coming together and we're working together. We're training one another. We're having these massive calls with multiple people to get everybody on the same page and up and running. And I think it's all been really hilarious. We had one circumstance where we were on a mass call, and one person's camera was upside down. So the whole meeting, she was upside down, and that gave us a real big chuckle as we were all learning and onboarding in this new virtual environment, because prior to this, we all worked in an office together.
So Coty, one of the new things that we want to try out is asking you to answer questions from real students. And I was lucky enough to have a conversation with a young woman in Amsterdam called Fien. Fien is a 15-year-old high school student who wants to go to university to be a doctor. She wants to work in healthcare. And she has two questions that she'd like to ask you. The first one is, do you think that robots will take over the jobs of nurses?
These are such great questions, and I'm so glad she asked, and I'm so glad she's thinking about these things in the future. I will likely learn from people like her as she grows up and enters the field. I don't think that robots can take over nursing. I think that without the humanistic, caring approach, the critical thinking, the touch, the developing of relationships, nursing is obsolete. So I think, robots can assist us. Robots can improve our accuracy, can prevent errors, but they cannot replace the nurse, and they cannot replace the human-to-human relationship.
Great. Second question she had. She asked if there is any technology that you don't have access to, but you would like to have access to.
Yes. Well, I'm a dreamer. There's lots of things I've seen. Lots of my career, I've worked with elderly people who are in their home, maybe struggling to remain in their home as they age. And lots of times we'd see people who forgot to take their medication and then became unwell because of that, or took too much medication. They forgot that they took it earlier and took it again. I would love to see some type of technology where you could do virtual visits and have some type of a medication system that virtually could be controlled. So the nurse could have a conversation with them. It's time to take your medication. The nurse could remotely unlock, the box or the place where the medication is stored, and they could take it then, and there's no risk of taking too many doses, and they have a reminder, even virtually, to take their medication. I think that could really help people stay well, and I think it could help improve our capacity to help more people if we're doing it virtually like that.
Wow, I love that idea. So those were Dean's 2 questions. Thank you very much for answering. So Coty, tell me, how did you become Coty Snider, the public health nurse? Take us back to childhood. What did you like? Were you always interested in science and biology? Were you kind of the nurturing, giving, caregiving kind of person? What were your favorite subjects? What were your hobbies? Tell us.
Yes. I don't think as a child, I definitely didn't have a drawing to nursing. I was very outgoing and gregarious. I was definitely a people person. My mom would say social butterfly. I loved caring for animals. I loved caring for children. I loved making people laugh. And I played a lot of sports and things like that. But I was exposed to a lot of people in need. I went to long-term care homes and nursing homes often with my family. We had immigrants or refugees come stay with us a number of times. So I think the exposure to different types of people was really good for me.
Mm-hmm. Did you have any particular role models who kind of set you on your path?
Not particularly for nursing. However, back in 2003, I started in healthcare, and I was in a caregiver role, and I worked with a lot of nurses, and I really looked up to them. I had one particular supervisor. Her name was Pat, and I really looked up to her. She seemed to know everything. She had all the skills in the world. She knew how to connect with people, make them feel safe and at ease, and I really admired her. So that would be one role model that I had that led me into nursing.
Was there any one particular incident, experience that the light bulb went off and you said, I want to be a nurse?
Yeah, I think it was really hard. Growing up, it was really hard. I was biracial. I was adopted. I grew up in a predominantly Caucasian family. And so my journey to kind of figuring out who I was a little bit different, a little more challenging. And so when I think back, there's been a lot of moments along the way, but I think one of the most pivotal moments in that journey and figuring out kind of where I fit was I had an opportunity when I was 16 to volunteer at a seniors home. Once a week, they had ice cream parties, and my job was to go to the seniors home and scoop ice cream. And I wasn't really excited about doing this, but week after week I went, and I started to develop relationships with these elderly people, and I started being able to help them with their wheelchair or their walker and answer their questions. And after 3 months or so of doing this, I was really inspired to work with people and to be a helper.
Wow. And it all started with ice cream, scooping ice cream. How cool is
Exactly.
that?
Yeah.
I remember there must be something about Canada, because I remember when I was young too, I used to go almost every Sunday and just visit with old people in senior citizens home, just of my own volition, no program or anything.
Yes.
And I liked them because I think I was young. I must have been about 12, but they gave a lot of candy. That was one thing.
Yeah.
And also they showed all the photos from back in the day. And they told these stories, and I thought their lives were so interesting. It's really a wonderful childhood memory. But back to the interview.
Yeah.
So tell us a bit about how you acquired your tech skills, right? Because you're talking about databases and statistics and everything else. did you learn all this stuff during nursing college, or did you learn it on the job? What kind of things did you have to learn?
Yeah, it's really interesting because when I started in healthcare, like I said back in 2003, there was no technology in healthcare, right? We did everything manually. We did our blood pressures manually. We charted on paper. So a lot of my learning in the early time, I mean, I was behind the buck in terms of technology for sure, and I didn't have all that much interest. So some of my learning came from just bugging my friends. I'm working on this project. I want to learn how to use Excel. I want to learn how to use these databases. So some initially came from friends. I took a course on my own for coding because I was interested in it. I didn't enjoy it. It was really hard for me, but I got through that. And then as I continued my education over the years and went back for continuous post-secondary education, there was more and more technology introduced, right? So our classrooms are in an online environment, so that helped me to develop those skills. Every placement that you go to, you take courses related specifically to their databases and technology and their machinery. And, you know, in my current role, I volunteer for every single opportunity to learn. I'm able to be sort of a lead and a trainer for a number of software programs that we have, and be able to train the rest of my team. And that's just seeking ongoing opportunities for learning and certification. And now I'm, you know, pretty good with it.
Good on you. This is fantastic. Fantastic. So a large part of it you're saying is that it's independent, self-directed learning, that you've just taken it upon yourself to master this kind of stuff. Cool.
Yeah.
Take us back to your nursing studies. So what subjects did you take, and like particularly your later degree, what technology did you learn about? How technology works? Like, how does a ventilator work? How does a heart monitor work, or a blood pressure machine that you basically measure blood pressure? Did you learn all that stuff?
So in our nursing program, you know, we do a lot of science, as you know, and then anything as it relates to the machinery is really specific to the workplace. So, you know, we do know how ventilators work and that there's pressures. We didn't learn the specific technology because it's really individual for each workplace, because each workplace uses different types of machines that you set up and use in different ways, and that give output of information in different ways. So we did have practice labs. In those practice labs, we actually had like robotic dummies that had heartbeats and respirations and blood pressures and could make noises. So we did practice the machinery for use on patients that we had access to in the practice labs. And we did practice, you know, emergency scenarios on these robots. But really the individual machinery training is on the job. You get certified for each different machine at each different workplace and each different sector. So
Coty, tell us what your favorite hospital device or technology system is.
yes, as I talked about earlier, my favorite device is the infusion machine. So this is a machine that you put your IV lines through, and they calculate the drip rates, which go directly into your patient's bloodstream. So it's really important that this be precise. And when I started nursing, I had to calculate drip rates manually with my stopwatch, counting drips for a full minute. Was it the right number of drips? No, it wasn't. I'd have to readjust and count for another minute. It took a lot of time and a lot of time away from the patient, and it was an awkward process. And, you know, when you're in the hospital in acute care, almost every patient has an IV for something, medication, fluids, whatever it may be. So I love the infusion devices. They're very precise. They prevent errors. They give us alarms if there's a problem. And it frees up my time to be able to work directly with my patient, to observe them, to assess what's going on, to determine next steps, and build a trusting relationship with them. So that's my favorite device by far.
And speaking about devices, obviously there's a lot of technology that's going into COVID-19 healthcare. Can you maybe talk about some of the devices and machines that you're using to help patients?
So although I don't provide the frontline care, we've got amazing nurses that work in the hospitals and ICUs doing this care. ventilators, we hear a lot in the media, and they're a really important part of managing COVID-19 in severe cases. So a ventilator is basically used in an instant where somebody's not getting enough oxygen in through their lungs and into their bloodstream. We need oxygen for all of the functions of our body to work, and importantly, our brain to function. So ventilators are a system that goes on a patient. They're measured, the pressure is measured, the humidity is measured, the amount of oxygen is measured to ensure that the maximum amount possible or amount of oxygen is getting into their bloodstream, and so that they can have time to recover until their system recovers, that they can bring in enough oxygen on their own. So these are really complex machines with many warnings and information output. They're set up differently for each patient. We've got amazing respiratory therapists who support us in measuring the right amount of, pressure and oxygen for our patients. And so they're really complicated, they're really fascinating, and they definitely save lives.
Wow. Yeah, because we hear a lot about the ventilators. So
Yeah.
absolutely, it's nice to get your input in how they work and how you use them. My next question is, so you've got kids who are interested. Obviously, the pandemic has really raised our awareness of healthcare and stuff. And I can imagine a lot of kids are interested in going into healthcare. What advice would you have for schools in terms of preparing kids to enter healthcare and to get the tech skills that they will need for both their study and like on the job experiences?
Yeah. I'm really pleased, at least in Canada, there is a lot more technology use than there definitely was when I was growing up in the 80s, especially with COVID-19, right? There's virtual schooling and distance learning and building tech skills. So, basic computer and technology literacy is definitely a must. There are a lot of skills you can develop after that in nursing. But, one thing that's really important if you're going into a healthcare career of any kind is research. So being able to access up-to-date, accurate, peer-reviewed research, the databases, learning how to critically appraise those, utilizing systems to help you critically appraise and apply the research to certain scenarios. I think those type of research and technology skills are something that would be really great for the schools to add in, because evidence-informed decision-making is a really important part of nursing.
Absolutely. And my final question to you, maybe not the final, but let's just see, is what can parents be doing to nurture children's interests? If they have an interest in healthcare and science and math and data science, what can parents be doing? And if you could be really specific in terms of examples of apps or games or programs or YouTube videos that parents can be exposing kids to.
Sure. It's interesting because nursing combines so many things, right? There's the humanistic side, which is very important. There's the science side and the technology side. All are, equally important parts, in a nursing career. So in terms of the humanistic part of things, really exposing your kids, leading by example, exposing your kids to people different than you, people in need, is a really great thing. Building resilience, doing, mindful activities and things like yoga at home to build, emotional resilience and coping. We have this little yoga activity by Tara Goober and Leah Kalish. And so, my family does some yoga activities to kind of help to ground us and make us aware of what's going on. And then in terms of technology, there's lots of things that you can find online. National Geographic has a science edition app that you can use. There's the Little Hospital app, and there's a number of other apps that you could find online. I think you can post those for us, Deborah.
Yeah, absolutely. Coty, thank you so much. This has been so great and so illuminating in terms of showing us that there are, of course, nurses that are on the front line and working directly with individual patients, but there's also another category of nurses that are more in the background, but using technology to deliver really important healthcare services. And you're one of them. So thank you that you are doing this kind of work that needs to be done. And I just wish you all the best with the COVID, and hopefully with the vaccination rollout, you will be less busy.
Thank you so much. We will get there. Thanks for having me.
You're welcome.